Prescription drug diversion is defined as any criminal or illegal use of a prescription medication. Examples would include selling pills, sharing a prescription with someone else, using a prescription in a manner other than how it has been prescribed, such as snorting the pills, chewing them, crushing them, and injecting them. I've been a practicing emergency medicine physician for 19 years, from the year 2000 to 2011 in West Virginia. I've experienced prescription drug diversion in the emergency department, in our medical practice, and as a result of prescription drug diversion, our area has suffered greatly. More than 44,000 individuals died of prescription drug overdose in 2011. Data from 2012 shows that there's a small reduction in prescription drug overdose deaths. West Virginia, being such a small state with a relatively small population and certainly a small number of physicians, leads the nation per capita in prescription drug overdose deaths. Also, what's astonishing is the small state of West Virginia, with its small physician workforce, prescribes more benzodiazepines like Xanax, Valium, Ativan, medications of that nature, more than physicians in any other state. This alone is absolutely stunning. Our state has suffered so terribly from this. You know, families are being absolutely devastated. Entire communities are devastated. And here in southern West Virginia especially, this is of epidemic proportions. And on the tail end of this is the now completely out of control heroin epidemic, which is happening as a result of a small diminution in the availability of prescription narcotics. As a practicing physician, I was targeted by many patients for doctor shopping. The amazing situation here is that unlike heroin, which comes from poppy fields in Afghanistan, or cocaine, which comes from coca plantations in Colombia or Peru, prescription drug overdoses resulting in death come from legitimate prescriptions prescribed by almost all physicians, dispensed by pharmacists, administered by nurses and EMS. This is the origin of these things. These are legitimate prescriptions. So this is a huge difference between illegal drugs in that these start legitimately. And they candidly shared with me methods they used, the ways in which they obtained pills, the ways in which they targeted what type of physician would be the best for them to obtain pills from, the type of pharmacy they would target to get these prescriptions filled, the type of patient they would prey upon to attempt to buy pills off of. These methods are astonishing, and the medical community knows little about these things. As a result of doing these surveys and these interviews, I published research on this, which culminated in us writing the textbook of prescription drug diversion. Our community has suffered greatly from this, and I would like to do whatever I can to rectify this situation, to give back, and to make a difference. Towards this end, we have started the Institute for the Study of Prescription Drug Diversion, which basically is an entity involved in educating the physician workforce, educating nurses, EMS, law enforcement, criminal justice system, pharmacists. We have put on seminars throughout the state at various universities, civic organizations, and medical societies. And it's my passion, my mission to bring this awareness of how prescription drug diversion truly happens. And also, we have created a patented technology system which kind of using reverse engineering techniques has created virtually an unpenetrable system to prevent diversion from happening. So my experience in this is firsthand. And like I said, I've been involved in this on both sides, and I see the devastation it has caused. And I believe for this reason, through my personal experience, through the research that I've done, through the training I've provided, and the books we've published on this that I have unique experience in this.